question I get all the time. I see this really frequently when people that I tutor are scoring kind of low 60s and they can't really fully get to a high 60s to feel comfortable taking the exam. And I actually used to send people in with low 60s to take the exam years ago. But the thing is, ultimately, the passing line has gone up a little bit higher and the failure rate has also gone up a little bit higher. So I am a tutor that is a little bit more cautious with sending people in than others are. So I would prefer that you're scoring in the high 60s range before you sit for the exam. That being said, I have some tips of kind of how to get from a low 60 to a high 60. And I'm pretty sure I have a video on that, so I can tag you in that and anyone else who wants to be tagged in it as well. Or I can make a new one if I did not post that video. But ultimately, I would say this is not a lost cause. I've seen people quickly, increase to the two higher 60 exams in the last 2 weeks of the exam, but it ultimately depends on kind of how you handle that amount of pressure. So I've had some students who are like, I would rather have a little bit longer and take my exam when I've had some buffer room of hitting the high 60s, but I also don't think that it's unrealistic to be getting high 60s within 2 weeks from where you are right now with just a little tweak. So I'd prefer to see those scores before you sit for the exam, but I would not say that you are in a bad place of where you are at right now. Getting 60% is great, getting low 60s is great, but to feel 100% ready that you're gonna sit for the exam and pass it, I would say let's make a couple tweaks and get you to those high 60s so we can be really confident that you're going to be ready for the exam. Okay, I hope that helps. I forgot to say one last thing. I am not the kind of tutor that will tell you yes or no to taking the exam in general. I think of this as a shared kind of decision making together, kind of similar to how you work with patients, as a physician as well, that I think this is a decision that we make together. So sometimes people feel really confident in the low 60s and they are doing it so consistently and they know that they're a good test taker and they feel like they will get through it on the real day. And you have my blessing if you want to do that. But I always try to give people all of the information so they can feel the most prepared to make the best decision. But ultimately it is about you and how you feel. And if you feel ready to go, then I want you to feel ready to go. And I want to support you in whatever decision you choose.